Imagine a world where age is just a number, where movement is fluid, and pain is a distant memory. But in the reality of aging bodies, the journey towards optimal health isn't always straightforward. Join me as we unravel the secrets to maintaining mobility and conquering the challenges of degenerative arthritis. As people get older and don't exercise much, their body functions start to decline. They might notice more than just stiffness when they move their joints. It might feel like something's catching. Their joints could swell, turn red, and hurt more, especially at night. Over time, this kind of pain can build up and lead to a diagnosis of chronic degenerative arthritis. The outcome of knee strengthening exercises can change based on how bad a person's condition is. If someone finds it hard to walk, their main aim for treatment is often just to walk comfortably again. Some people have felt better from knee arthritis or back issues by exercising, even before their pain gets really bad. But it's important to know that some exercises might make pain worse if they're not done right. Keeping the right posture during exercise is important to stop pain from getting worse and to slow down arthritis from getting worse too. Many people make a common mistake by trying to lengthen their walking stride. Maybe after watching online videos or reading health tips, thinking it'll help them walk faster. But if you've tried this and felt more pain, I'd like to know about your experience. I'll advise against widening your stride. Actually, if you have severe arthritis already, widening your stride might worsen it. Like we mentioned earlier, using wrong techniques such as widening your stride, or pushing back without properly extending your knees, or relying too much on thigh or knee muscles to push, can slow down your walking speed. This can lead to more inflammation and pain. In cases of lumbar disc issues, arching your back too much or locking it in place can weaken the discs even more, which isn't good. Also, putting too much pressure on the back of the spine, where the back muscles are, can increase pain too. Balancing tension is important. Too much isn't good. Here's a simple 5-minute knee strengthening exercise you can try. If going outside to exercise with weights is tough due to knee pain, start by sitting down. Extend your legs and lift them up, then lower them down. Extend again and lift. Repeat this for a bit. Take 3 breaths, then lower your legs. Do this about 8 times to finish a set. Next, stand up, raise your heels, take 3 breaths, and repeat 8 times. This exercise also helps with stretching. Put your foot on the back of a chair or something slightly lower than your hip. It's best if it's a bit lower than the chair. From this position, gently push as if you're pulling your foot forward. Repeat while taking 3 breaths, then do it 8 times. Just dedicating 5 minutes a day to this routine can bring about noticeable improvements. Even in severe cases where movement is tough or barely possible, creating movement itself can have an impact. Exercises done while sitting or standing, even without using the joints, can help lubricate them and are important. For those who can already walk comfortably, increasing your pace can make your heart beat a bit faster and your breathing slightly quicker. Depending on your joint and body condition, gradually strengthen them step by step. If you feel more pain during exercise, remember this. If it feels too much, dial back the intensity a bit. Repeat at a lower intensity, then give it another shot. Don't be afraid to try and stay hopeful. Slowly increase your intensity step by step. To prevent degenerative arthritis, the best exercise as you get older is to get your heart pumping and increase muscle strength. It can be tough for those who haven't focused on strength training or haven't exercised much before. If you're able, running or jogging is great. If not, skipping rope is a good alternative. Contrary to what you might think, skipping rope is easier on the knees because you're jumping with both feet instead of running. If that's not doable, you can try jumping in place. Besides skipping rope, it's important to be able to flex and extend your ankles, knees, hips, and waist simultaneously. This is crucial. Even if you feel more pain than expected, don't avoid this exercise. It's important for your overall health. It's important to be careful when climbing stairs or hiking, especially if you're already experiencing pain. Many people heed this advice, but for those already in pain, it's important to listen closely. Even if you're dealing with arthritis pain, it's worth making the effort. I'm now over 50, which is quite different from when I was younger, so please be careful. When you start feeling pain, especially during activities like climbing stairs or hiking, it's important not to push yourself too hard. Overdoing it is a hallmark of degenerative arthritis. While this condition can affect young people too, the slower recovery speed means inflammation and damage can accumulate, potentially leading to surgery down the line. When pain starts, keep it simple. Even if you just feel a bit stiff in the morning, don't push yourself too hard. Recovery takes time, so even if you've done it before without issue, forget that notion. After intense exercise for a day or two, you need to allow yourself time to recover. The first sign is slight pain or stiffness, and the key is pain that you can bounce back from within a day or two at most. That's manageable pain, but you should stop activities causing such pain immediately. Sudden pains, especially when changing posture or direction, require caution. If you hear a sudden popping sound or sensation, pause for a moment. In some cases, if you start feeling pain, it's important to look an orthopedic examination promptly. This is especially true for issues like muscle tears, ligament injuries, or when you feel something catching in your joints beyond just stiffness. If swelling, redness, or worsening pain at night occur, immediate treatment is necessary. As we age, joint pain can worsen, signaling arthritis. But simple exercises like seated knee lifts done for 5 minutes daily can help. Start slowly and gradually increase intensity with activities like jogging or skipping rope, but be careful and don't push too hard. If pain persists, seek medical advice promptly. If you enjoyed this video, please like, share, and subscribe for more helpful content. Be sure to click the notification bell so you never miss an update. Let me know in the comments what topics you'd like to see in future videos. Thanks for watching. Wishing you success and happiness. Stay tuned for more great content.